everyone, my name is Markitta Davis. Today I will be speaking on a very common psychological disorder known as anxiety. Many people are very familiar with that term, whether we have family or friends who deal with that. It is affecting about 18.1% of individuals today in America. There's many different types of disorders that falls under the category of anxiety. First, we're going to talk about the subtopics, which will be the types of anxiety disorders, symptoms, the cause, as well as how it's diagnosed, the treatment, as well as the prevention of anxiety. The first disorder that we will talk about is known as the panic disorder, which many of us are aware of. It's a sudden strike of terror. Symptoms for the specific disorder include sweating, chest pain, palpitations, also known as irregular heartbeat, and pounding of the heart, and also a choking feeling. The second disorder that will be explained is known as social anxiety disorder, which is an overwhelming worrying and self-consciousness of every social situation. Also the fear of being judged by others, and an act of embarrassment which allows the person to get ridiculed. So they try to stay away from that. Also, the third disorder is known as social phobia. Intense fears of specific objects or situations. Say, for instance, if a person is afraid of heights, they're going to try to avoid that. That's their phobia. They're definitely not going to go towards it. Just like a person who's also afraid of insects, different animals, different things like that. Their anxiety, they're going to stay away from it. That's their phobia. The fourth disorder is known as generalized anxiety disorder. Now this disorder is very excessive, unrealistic, worrying, tension that the individual will show. There's also a fifth type that many of us are aware of. It is called post-traumatic stress disorder, also known as PTSD. Now, when we think of PTSD, right away, some of us may think of a person who's been in the military and is going through things after have been in war, have been out there dealing with different things. But it doesn't necessarily have to be a military personnel. It can also be just flashbacks and tormented memories from some kind of intense injury, some kind of physical injury, or anything like that that may cause trauma to a person and may cause the flashbacks. Also, the sixth type of disorder is known as obsessive compulsive disorder, also known as OCD, which is another common term many of us are aware of. It's known as obsessive thoughts and repetition of compulsive acts. For instance, a person may have to wash their hands 10 times before doing a certain task, or they may have to just do things back and forth to make themselves feel comfortable, when in reality it's a compulsive act that they can't really control. Now that I have discussed the different types of anxiety, I will describe the symptoms, which there are like an endless list of symptoms for anxiety. For instance, there's panic, fear, feeling of uneasiness. There's sleeping issues, where that anxiety is just so much to bear on a person and they can't get a good night's rest. Shortness of breath, cold, sweaty hands or feet, not remaining calm, of course. Heart palpitations, once again, is the pounding or irregular heartbeats that a person will experience. Dry mouth, muscle tension, chest pain, and hyperventilating, which many of us are aware of whenever we kind of put two and two together, hyperventilating and anxiety whenever panic attacks happen. Dizziness, nausea, and numbness, which is also tingling in the feet, hands, are also all symptoms of a person experiencing anxiety symptoms. Moving on from the discussion of symptoms, the cause of anxiety will now be explained. The cause and factors of anxiety may seem like it has an easy ending to it, like it's pretty simple, but there's still some studies going on to really find out that cause. In reality, there's no cause for anxiety. there are factors, which it can be genetic, it can be inherited throughout family. Some risk factors include changes of the brain as well as environmental factors that can cause a person to have that anxiety. As we have understood the cause and factors of the disorder, I will describe how anxiety is actually diagnosed. It can be diagnosed in various ways. For instance, interviews and assessment tools will be used by doctors, psychiatrists, psychologists, and any other trained professional trainers as far as how it's diagnosed, what kind of medication may be given, and how that situation per person may be subjected to. Now, understanding how the disorder is diagnosed, now let's go through the treatment for anxiety. There are a few treatment options to help with anxiety, such as medication to help reduce the level of anxiety symptoms. There's also psychotherapy, which is counseling to address emotional response to mental illness, and also a talk-through strategy with a therapist. Cognitive behavioral therapy is where the person recognizes and changes through process behaviors which lead to negative feelings. So basically, they'll sit with a therapist, go through everything that has them torn down, which causes anxiety, and the therapist will then help build them up in confidence and positivity levels and kind of cope with that anxiety. Dietary and lifestyle changes, believe it or not, is also a kind of coping method as far as anxiety, and also relaxation therapy. Lastly, after we have reviewed the treatments of anxiety, I will now explain the preventive measures. Let's see. Anxiety, unfortunately, cannot be prevented. It can be controlled. For instance, stopping and reducing the intake of caffeine consumption. Various medications are out there, and there's much counseling to help with that common psychological disorder. Now, let's review the topic and subtopics that were just discussed for anxiety. Anxiety disorders, as we know, has a more complex definition than what we may have thought before I actually gave this speech. Now, there's a little bit more to think about. There's more subtopics and things like that. In closing, if you or someone that you know are struggling with anxiety, maybe have some symptoms, try not to wait and let it affect your life, but instead seek help, because help is definitely out there. Thank you.